Smell. Topa. Garlic-like smell. Okay, topa. Very important. Aluminium phosphide and zinc phosphide. For is there. For fish. Fishy odor. Fishy odor. Fruity cane. Fruity odor. Fruity cane. Fruity cane. H2S. Smell of rotten eggs. Cyanides very important. Bitter elements. Cannabis. Smell of burnt rope. Okay. Hepatotoxic poison. Paracetamol. Arsenic. Thallium. Phosphorus. Okay. Stabilizing airway, unabsorbed poison, removal of absorbed poison, and symptomatic treatment. In unabsorbed poison, inhaled poison, ask the person to move in fresh air. Contact poison, uh, copious wash with water or normal saline. Ingested poison, emesis, gastric lavage, or activated charcoal. Emesis is usually not done. If it has to be done, should be done by Ipecac. Normally not done. If it has to be done, it should be done by Ipecac. A gastric lavage and activated charcoal can be used for most poison, but has limited role because most patients present after 1 hour. Their use is typically within 1 hour, but most patients present after 1 hour, so the use is limited. So the poisons which can be used, so the treatments which can be used for most poisons, there you remember the contraindications, and the poison which are and the treatments which are used only for few poisons, there you remember the indications. Ipecac is a substance, Ria, which is used to induce emesis. Okay, so for gastric lavage, anything which starts with co for corrosive, co for convulsive, co for comatose patients, co for kerosene, and other volatile poisons. Why? Because in corrosive poisoning, they lead to GI perforation. So it is contraindicated in all corrosives except carbolic acid, because carbolic acid makes the stomach wall hard and leathery. So there is no risk of perforation. Convulsive, comatose, kerosene, because in these conditions there is a risk of aspiration. Aspiration. The other things are esophageal varices and bleeding disorders, because there is a risk of bleeding. Okay. Yes, aspiration can occur. No, for example, the person is convulsive. You put the gastric lavage tube, and when you put the gastric lavage tube and then you suck out the fluid. When you suck out, then what happens is there is chances of vomiting. If vomiting occurs, then convulsion can occur. Then if vomiting occurs, then if vomiting occurs, then in a convulsive patient or a comatose patient, there are higher chances of aspiration. Are you getting me? Because in gastric lavage, we put a large amount of fluid first inside the stomach and then we suck it out. By this process, the chances of vomiting increases. In a normal person, even if vomiting occurs, he can protect himself from aspiration. But in a convulsive comatose patient, if vomiting occurs, that vomit material, he's not able to protect himself. That vomited material goes inside the respiratory tract. Activated charcoal can be of two types: single dose and multi-dose. Mostly we use single dose activated charcoal. So if only activated charcoal is mentioned, it is not specified, That means we are talking about single dose activated charcoal because mostly we give single dose. So there you remember the contraindication. What are the contraindications? Mohawk. Mohawk is the contraindication and very commonly asked. For multi-dose, they are to be given only in few poisons. They are given in those poisons which undergo enterohepatic circulation. It is useful in few poisons only. You can remember the mnemonic. These people drink charcoal quickly. These people drink charcoal quickly. Okay. Universal antidote, ATM. ATM is present everywhere. So universal antidote. Two parts, one part, one part. Forced alkaline diuresis is done for weakly acidic poisons. Example, barbiturates, chloropropamide, methotrexate, and salicylate. So BCMS, BCMS, BCMS. Very important. Hemodialysis is used in heavy blast. Hemodialysis is used in heavy blast. Charcoal hemoperfusion is used in BST. BST. Barbiturates, salicylate, and theophylline. Okay. Now, treatment. The treatment which is common to both methyl alcohol, ethylene glycol, it is main treatment is either we give fomepizole, that is 4-methyl pyrazole, or ethanol. Either of them can be used. That these are the main treatment. Main treatment. Either of them can be given, but if you have to choose one, choose fomepizole. Then the second is for both of them we can do hemodialysis. For both of them we can use sodium bicarbonate for acidosis. Then only in methyl alcohol we use vitamin B. Any idea? 9. That is folic acid. Only in ethylene glycol, vitamin B1, vitamin B6, and calcium gluconate for hypocalcemia. Benzodiazepine, plumazanil. Opioid, naloxone. Sympathomimetics, diazepam. Anticholinergics, a cholinergic drug like physostigmine. Cholinergic poisons and anticholinergic like atropine. Organophosphate, A, P, D in this order. Atropine, pralidoxime, and diazepam. For carbamates, atropine, and this diazepam. We don't give pralidoxime. For organophosphates, we give only diazepam. And we give anything else apart from diazepam? Organochlorine is not cholinergic poison. So that's the reason in organochlorine we are not giving atropine. Cholestyramine. Cholestyramine. HOE causes hypocalcemia. Howe causes hypocalcemia. So we give calcium gluconate. Howe causes hypocalcemia. Howe causes hypocalcemia. So we give calcium gluconate. Heavy metals, chelating agent. Normally, the activated charcoal is not to be used for activated charcoal is not to be used for heavy metal, but thallium is an exception where we use activated charcoal. In fact, we use multi-dose activated charcoal. And what else we use? We use Prussian blue. What is the chemical name for Prussian blue? Anybody? Potassium ferric ferrocyanide. Potassium ferric ferrocyanide. For copper, why I am writing copper here? Because for copper also, we have a similar antidote, that is potassium ferrocyanide. So one ferric extra in thallium, because thallium, it's just a way to remember, it's more poisonous. One more ferric. And then the chelating agent is, of course, penicillamine. Please remember, thallium is unique. Why? Because normally in heavy metals we use chelating agent, but in thallium we don't use chelating agent. We don't use activated charcoal in heavy metals, but in thallium we use multi-dose activated charcoal. Okay. Phosphorus is CuSO4. 4 here, 4 here. And KMnO4. Again 4 here. Phosphorus, CuSO4 and KMnO4. Snake is anti-snake venom. Scorpion, prazosin, carbon monoxide 100%, hyperbaric oxygen, aluminum phosphide, zinc phosphide, magnesium sulfate. It acts as an anti-arrhythmic. It stabilizes cardiac cell membranes, basically anti-arrhythmic. Methemoglobinemia, M for methemoglobinemia, M for methylene blue, because methylene blue helps to convert ferric to ferrous. Cyanide, we give amyl nitrite, we give sodium nitrite, and we give sodium thiosulfate. These three compounds were the combination in the traditional Eli Lilly cyanide kit. But later on, afterwards, we had another antidote, that is hydroxycobalamin, which is considered to be the best. Okay, then calcium disodium, calcium dicobalt EDTA, calcium dicobalt EDTA. These are the antidotes. Previous slides, पढ़ लो. Okay. Acetaminophen, N, acetyl cysteine, vitamin K, digoxin, digitalis purpura and oleander. Digitalis purpura and oleander have same mechanism as that of digoxin. So we will use atropine for bradycardia, lignocaine for arrhythmias, and digibind antibodies. Digibind. Drugs which primarily cause metabolic acidosis, there we will use sodium bicarbonate. Sodium bicarbonate. Okay. Now, chelating agents, BAL, DMPS, and DMSA. These three can be used for multiple. First three can be used for multiple heavy metals like arsenic, mercury, and lead. The below three are used for single, calcium disodium EDTA for lead, penicillamine for copper, and here this is for iron. So lead you can see is here also and here also. So in lead actually we use calcium disodium EDTA, that is very good, but it does not remove from brain. So calcium disodium EDTA is never used alone. It is used with one of the above, BAL, DMPS or DMSA, but BAL is considered to be the best. DMPS, DMSA you can use only if the poisoning is very mild. Otherwise, BAL is the best. Okay. Contraindications of BAL is selenium. Sorry, I will not write. Contraindication of BAL is selenium, iron, cadmium, and organic mercury compounds. For inorganic, we can use, but not for organic. So SICO is the contraindication. SICO is the contraindication. Coma cocktail. The composition is dextrose, naloxone, and vitamin B1. So you can remember DNB causes coma. DNB causes coma. Last slide. Okay, routine viscera preserved in all poisoning. Stomach with content. Small intestine with content. Portion of liver with gallbladder. Okay, then spleen and half of each kidney, blood, urine. These are preserved in all poisoning cases. Specific poison, brain in, you can remember the mnemonic, boss ka brain. So BOS, boss ka, CA, brain. मीडियम फॉर प्रिजर्वेशन, अरे कहानी अभी चल रही है बच्चे, क्यों चिंता कर रहे हो, बताएंगे आपको, मीडियम ऑफ प्रिजर्वेशन भी बताएंगे. एम आई सॉफ्ट? ठीक है. स्पाइनल कॉर्ड, स्ट्रिक्नीन एंड जेलसेमियम. Alcohol, now please remember, alcohol goes everywhere, so you can remember that alcohol goes in alcohol. You can preserve brain as well as CSF as well as vitreous humor. Remember like this. Heart is preserved in mainly in digitalis and oleander. Yes, oleander also it can be preserved. This is the cardiac poisons. Lungs, all gaseous poisons and volatile poisons. Cob, bile for cob. So here it is digitalis, oleander, and also strychnine. Actually, heart can also be preserved in strychnine poisoning. बच्चे इंपॉर्टेंट ना होता तो ये 5 घंटे की क्लास में क्यों पढ़ाता? एक बात बताओ मेरे प्यारे बच्चे. अननोन, आप अपना नाम तक तो बता नहीं रहे, अननोन लिखा हुआ है आपने. फैटी टिश्यूज, द pesticides, insecticides, they basically go and accumulate in fatty tissues. Skin, injectable poisons. Bones, hairs, and nails. Heavy metals. Heavy metals, especially arsenic. डर का माहौल क्यों है भाई? ये तो इतने प्यार से पढ़ा रहा हूं. यूट्रस, क्रिमिनल, अबॉर्शन. लड़कियां से जवाब देगी, बोलो टुडे आई एम सॉफ्ट और नॉट, या आज भी मेरे चीखना चिल्लाना चल रहा है. Now, the preservative use. So we use the preservative for viscera, and we use preservative for body fluids. Preservative for viscera, if we talk about preservative of viscera, please remember formalin is never used. Formalin is used for histopathology, not for toxicology. Missing masculinity. भाई कौन है तुम? क्या सोच के क्लास करने आए थे? यू वॉन्ट टू सी माई मस्कुलिनिटी? क्लास में आए हो कुछ और इच्छाएं लेकर के आए हो? नाउ, so basically for viscera we have saturated solution of common salt and rectified spirit. Saturated solution, both are very good, both are used for most of the poison, so you have to remember only the contraindications. The most common is saturated solution of common salt, and best is rectified spirit. Saturated solution of common salt can be used in all poisons except strong corrosives, because you can simply write corrosives, except corrosives, because these corrosives, they react with sodium chloride, but except weak acids, weak organic acids, because organic acids are weak acids, they don't react with sodium chloride. What are the examples of weak organic acids which are corrosive but they don't react with saturated solution of common salt? So there we can use it. What are the examples of weak organic acids? Acetic acid, oxalic acid, carbolic acid. Okay, these are all weak organic acids. Acetic acid, oxalic acid, carbolic acid, formic acid. Okay. Rectified spirit is not to be used in volatile papa. So volatile poisons, example kerosene, etc. Volatile papa. P for phosphorus. A for alcohols, because rectified spirit is itself 90. What is rectified spirit? 95% ethanol plus 5% water. Rectified spirit is 95% ethanol plus 5% water. So phosphorus, alcohol, paraldehyde, and acetic acid and other weak acids, plus other weak acids. Other weak acids like oxalic, carbolic, formic, other weak acids. Okay. Now, substances which can be detected even if person has not consumed. What can be the reason? One is because of putrefaction, or after death also various metabolic processes undergo in the body, which leads to production of certain substances. What are these? What are these? As a product of putrefaction, what can be produced inside the body? Ethyl alcohol, carbon monoxide, and cyanide. These can be produced. Okay. And other thing is that suppose you are doing exhumation, then from the nearby in the soil, normally arsenic is present, so that can be detected because of that reason. Okay, so these are the substances which can be found in toxicological analysis even if the person has not consumed them. Now, preservative is added to all. So for blood, urine, vitreous, which is the preservative which is added to all body fluids? Sodium fluoride. That's the main preservative. Okay. What? 1 minute. Please remember one thing. In case the body fluid is blood, in case of blood, we add sodium fluoride, but we also add an anticoagulant like potassium oxalate. Why do we add sodium fluoride? Because it inhibits, which enzyme it inhibits? It inhibits enolase. And inhibition of enolase inhibits glycolysis. So if glycolysis is inhibited, unnecessary ethyl production will not occur. Ethyl alcohol production will not occur. And also it prevents the growth of bacteria. सर आप कौन से कॉलेज में पढ़ाते हो? बेटा मैं किसी कॉलेज में नहीं पढ़ाता. I am into clinical research. I do human experimentation, first in human trials. The drugs, especially the oncology drugs, the immunotherapy, immuno-oncology. I am into immuno-oncology. Okay, more into the cancer research. Associated with a US-based company, and I am involved in first in human trials, especially focusing on immuno-oncology. Especially those PD1, especially the PD1 inhibitors and CTLA4 inhibitors. PD1 inhibitors and CTLA4 inhibitors you would have studied in your pharmacology. Sir, after forensic, what have you done? Yes, immune checkpoint inhibitors. I have not. अरे क्यों करूंगा फोरेंसिक के बाद? एमडी डिग्री कर ली, पढ़ता ही रहूंगा. पढ़ लिया, काम किया, एमबीबीएस कर ली, एमडी कर ली, बहुत है. पर ये इसका फोरेंसिक से इट इज नॉट रिलेटेड टू फोरेंसिक. ठीक है ना? So don't get confused. I don't want to mislead you. Whatever I'm doing in clinical research has got nothing to do with forensic. Okay, so you don't think that it is a career path of forensic medicine. That's as your guru, my purpose is to guide you. I am an exception. Normally, this is not the career path. How I took it is a different story. But forensic medicine people, they teach in medical colleges, they do autopsies, they do medical legal work, which I am not doing. I am just enjoying teaching with you. Okay. Is it good earning? भाई पैसे की बात आ गई सारी. मजे, अरे आनंद लो ना क्लास का. Carbon monoxide poisoning. In carbon monoxide poisoning, what you do is you put the lungs inside the in carbon monoxide poisoning, when you take the blood, on the blood you cover with paraffin wax, cover with paraffin, so that there is no exposure to air. They cover with paraffin so that there is no exposure to air. Virological examination, for if we suspect that person died due to some virus, if the person suspect that he died due to some the autopsy surgeon suspects person died due to some virus, then the sample should be preserved in around 50 to 80% glycerol or glycerine. And especially the most commonly reason of preserving is to see negri bodies in case of rabies. Best site for blood collection for toxicology sample in dead person is femoral vein, because femoral vein is away from chest and stomach. Because after death, what happens is that the there is a disintegration of membranes. So the blood, so the stomach and chest contents can mix up with the blood, contaminate them. So femoral vessel is little bit away, isolated. So femoral vein is the best. So let's look at certain plant images. Seeds. They are oval and dark brown in color. Here also the seeds are oval and dark brown in color. But the difference is in the first one, the seeds are mottled and also shiny. So the first one are ricin seeds. Ricinous seeds. Ricinus communis seeds. The other one, the second one is the castor seeds, sorry, croton seeds. Croton seeds. वो क्या लिखा डरमा हाउ डू यू मैनेज टीचिंग एंड ट्रायल वर्क अरे आई डोंट मैनेज तभी देखते नहीं हो शक्ल नहीं देख रहे मेरे बात बात पे गुस्सा आ जाता है रौद्र रूप धारण हो जाता है तो मैनेज नहीं कर आई डोंट मैनेज आई एंजॉय इफ यू एंजॉय things happen on their own I don't try to manage anything I just try to enjoy ठीक है मैनेज मैनेज नहीं होता मेरे से बट आई जस्ट एंजॉय सीड्स red egg shape per se so red is aberrus precatorius R for red R for red R for red R for red ओके किसी बंदे ने ये नहीं बोला सर शक्ल तो आपकी अच्छी है मैंने बोला शक्ल देख रहे हो मेरी ये ऐसे नालायक बच्चे हैं देन हार्ट शेप्ड पॉइजन with the projection heart shaped poison with the projection this is semicarpus anacardium cardium is heart shaped sir have you done autopsy I have done more than 5,000 autopsies okay I have done more than 5,000 autopsies then लिख तो ऐसे रहो जैसे मुझे फर्क फर्क पड़ता है तुम लोगों के सोचने से हैं अबे डॉन है अपन समझे सॉफ्ट हो गए तो क्या हो गया तो फर्स्ट वन इज कैप्सिकम सीड्स other is datura seeds size these are small these are big these are yellow these are kidney shape this is round sorry color was asked this is big this is brown kidney shape capsicum is pungent datura is odorless rbc shaped sheep these are strychnine seeds Strychnos naxvomica seeds plant Papaver somniferum poppy plant not poppy rule poppy rule कर रहा था here you can see the unripe capsule from there we take the juice the juice is dried and that gives a pheme or opium the active principle is morphine the seeds are khaskhas these seeds are called khaskhas seeds these are non poisonous, non poisonous. वैष्णवी लड़कियां बड़ी बदमाश हैं यहाँ की, देखो लड़के टॉन्ट मार रही हैं, इग्नोर लाइफ प्रॉब्लम, आवर सर इज इग्नोरिंग आवर चैट। लड़के बेचारे सीधे हैं। रेड बेरी एंड लीव्स विद 3 लाइन्स, दिस इज एराइथ्रो xylon cocoa. Normally there is 1 line, but cocaine plant, that is which gives cocaine, it has 3 lines. Red berry is cocaine. So last slide, just see the last slide. सर बुक में आपकी जो फोटो है, आप वैसे तो नहीं लग रहे हैं, तो कंप्लेन कर दो, फोटो किसी और की डाल दी, पढ़ाने कोई और आ गया। Okay, red berry is cocaine, blueberry is atropa belladonna. B for belladonna, B for blueberry. And trumpet shaped flowers, trumpet shaped flowers, these are datura, datura. It can be purple or white in color. Fruit with spines, this is datura. Okay. The first one is horse radish. The other 3 are aconite, monk's hood. So a person who is leopard jandus, he can confuse aconite with horseradish and consume aconite and die if he is leopard jandus. But if you see, the horseradish is basically cylindrical, aconite is conical. So corn. Taste, horseradish is pungent and aconite is sweet. And here if you see the flower has 2 parts. The upper part looks like a hood, so it's called monk's hood. The lower part looks like a lip, not lower lip, lower part looks like a lip. Okay. And here if we see, the aconite flowers are arranged in elongated clusters. The aconite flowers are arranged in elongated clusters. Then yellow bell-shaped flowers. This is yellow oleander, very commonly asked. Other simple white flower is white oleander. And beautiful, again, these flowers like this aconite flowers are arranged in elongated clusters. Similarly, these flowers are also arranged in elongated clusters. These 2 are digitalis purpura. So they're tubular, hanging downwards like pendant, and heavily spotted from inside. If you see, heavily spotted from inside. So digitalis and serrated leaves. This is cannabis. Bright yellow wrinkled flowers. These are Argemon mexicana. Argemon mexicana. एक लड़की कोई सवाल पूछती है चैट में, सारे लौंडे उसको आंसर देने के लिए झपट पड़ते हैं। Now, toxidromes. One word for CNS depressants is all depressed. All depressed. The sympathomimetic, agitated person. Anticholinergics, dry. Cholinergic, leaking person. Leaking person. Okay, leaking from everywhere. So, Abbo is CNS depressant. Set plaque is sympathomimetic. All antis are anticholinergics. All antis are anticholinergic. Okay, and which antimuscarinic? Classical example of antimuscarinic is atropine, and Dhatura also has atropine. D-monk is cholinergic. D-monk is cholinergic. Last slide, please. Now, mental states, same depression, or they will be sedated. Wait a minute. Comatose, sympathomimetic, there will be agitation, restlessness, anxiety. Now, sympathomimetic and anticholinergics have 80% similar features. So here also there is agitation, restlessness, anxiety. But one main very characteristic feature, there will also be delirium. Delirium. Cholinergic is variable state, I will say. And please remember, all of them can cause seizures except CNS depressants. CNS depressants are in fact used to treat seizures. Vitals here, it's decreased, decreased. In other two, it's increased, increased. Similarly, is the pupil size decreased, decreased. Here, in other two, it is increased, increased. But you remember one thing, that especially low respiratory rate, especially below 10, is especially a feature of opioids. And pupil size, please remember, CNS depression decrease pupil size except ethyl alcohol, what happens in ethyl alcohol? In ethyl alcohol, in early stages, it actually increases pupil size. Only in the late stages, the pupil size gets decreased. So this is opioid. Maximum CNS depression, especially respiratory depression, is in opioids. Pinpoint pupil is seen in opium and cholinergics. Sorry, opium and organophosphate, not all cholinergics, I will say, and organophosphates. Pinpoint pupils. Skin. CNS depressants is normal skin. Sympathomimetics, there is sweating. Anticholinergic, the whole person is dry, so there is dry. Cholinergic is a leaking, so here also sweat is present. And I told you that sympathomimetic and anticholinergic 80% features are similar, but there are certain exceptions. In sympathomimetic, the face is pale. Here it is flushed. So these are the two main differences. Anticholinergic, the person is dry. So there is constipation, urinary retention. In cholinergics, there is a leaking person, so dumb bells. D for diarrhea, and diaphoresis. U for urination, M for meiosis, B for bradycardia and bronchial secretions increase, E for emesis, L for lacrimation, S for salivation. ठीक है. इथाइल अल्कोहल कवर विद साइकेट्री. ओके, अभी खत्म करते हैं बच्चे, आधे घंटे में खत्म करते हैं क्लास, डोंट वरी. मिथाइल अल्कोहल इज ऑल्सो कॉल्ड वुड्स अल्कोहल. Illicit liquor adulterated with methyl alcohol is called hooch. Ethylene glycol is a common component of antifreeze in the cars, that is coolant. Main toxic metabolite of methyl alcohol is formic acid. Main toxic metabolite of ethylene glycol is oxalic acid. Enzyme competitively inhibited by both ethyl alcohol and fomepizole is alcohol dehydrogenase. ठीक है. Clinical features in both are CNS depressants. In both of them, there is high anion gap metabolic acidosis. Only in methyl alcohol, basically the oculotoxicity, blurring, blindness. Only in ethylene glycol, calcium oxalate crystals in urine and features of hypocalcemia. These envelope-shaped crystals are the calcium oxalate crystals seen in urine. Envelope-shaped crystals. Then the most toxic part is unripe capsule. Seeds we have already discussed. Treatment is naloxone. Cocaine is obtained from erythroxylone cocoa. Other name is white lady, snow, coke, etc. Different methods. Snorting is commonly done. Because of the snorting, it can lead to perforation of or injury to nasal septum. What was on the forearm? The person was taking, these are the injection marks. People take morphine by injections, heroin, morphine by injections, multiple injection marks. Speedball is combination of cocaine plus heroin, highly addictive. And what do you see? Small paper cap, small capsules. Can you see? This is packets. These are packets of cocaine. Packets of cocaine. The person is smuggling by ingesting it. This is called body packer syndrome. This is called body packer syndrome. And basically sympathomimetic features occur. Okay. So mental state is agitated, anxiety. So basically it causes intense stimulation of both brain and heart. Agitation, anxiety, seizures, all of them are increased. Vitals, cardiovascular, the intense stimulation of heart leads to arrhythmias. Even MI occurs. Chronic cocaine poisoning, black tongue and black teeth. It occurs in cocaine poisoning. Black tongue and chalky white teeth. It occurs in sulfuric acid poisoning. Okay. Feeling of insects crawling under the skin. So tactile hallucinations occur. And this is called formication or cocaine bug or Magnan symptoms. Okay. Datura. So these are Datura active principle is atropine, hyoscine, and hyoscyamine. So all D's occur, but D for diarrhea does not occur. There is constipation, dry person. किसको बोल रहे हो हाई बड्डी? अच्छा आपके पीछे? He is my son. How they are saying you hi? Insecticides. So organophosphates, carbon. Last slide. इसमें क्या है यार लास्ट स्लाइड में? Carbamates, organochlorines, pyrethrins. Which class, sir? He has just given his 12th exams. छोटा भेड़िया. सही है बेटा. So how do you remember which one is organophosphates? Phos on. Okay, no, not bio. He is taking physics, chemistry, maths. Phos. Whenever you see phos on, this is organophosphates. Okay. Carbamates. Remember the mnemonic? Carbs are. बाल विवाह हुआ था आपका? हाँ बाल विवाह हुआ था मेरा. देख लो ये बच्चे कह रहे हैं यू लुक सो यंग. तुम मानती नहीं हो. Carbs are mine. Carb are mine. Mine. Organochlorine. Whenever something ends with Ne or In. Ne and In. Okay. Pyrethrins and pyrethrotrins. Whenever you see thrin, that is insecticides. Organochlorines, it is used as insecticides. Which organic chlorine is also called plant pendrin, endrin, because it is broad spectrum. What the mechanism of action? It is basically a CNS stimulant. So it causes seizures. And here in for pyrethrins and pyrethrin mechanism of action is similar to organochlorines. These are least toxic to man. Good night, all out, etc. Now, corrosives, strong acids, strong alkalis. Strong acids are inorganic and organic acids. Severity of corrosive effects, the maximum is strong alkalis followed by inorganic acids followed by organic acids. Please remember that the strong acids and inorganic acids have only local effects. Organic acids have both local and systemic effects because they get absorbed. They get absorbed. Okay. Previous slide. देख लो. पानी डालो. Acid. C for coagulative necrosis. L for alkalis. L for liquefact. How much time left? I think it should not take much time. Maximum half an hour. Liquefactive necrosis. Eschar is a hard substance because coagulative necrosis occurs. Eschar formation occurs in acids, not in alkalis. So because of eschar, alkalis are more deep and severe. Okay, acids, because stomach already has acids, so acids affects stomach more. Alkalis affects esophagus more. Which inorganic acid causes liquefactive necrosis and systemic necrosis? Systemic symptom. This is hydrofluoric acid. It is an exception. It is inorganic, but still it causes both liquefactive necrosis and systemic symptoms. Now, Magenstras. The acids flow through the lesser curvature. So, stomach should be open through the greater curvature. Sulfuric acid, maximum corrosive effect, NH less, HCl less. Vitriolate, sulfuric acid is used because that's the most corrosive. Because most corrosive, it causes stomach perforation. Fuming and respiratory tract inflammation occurs by HNO3 and HCl. This we have already, this we studied stomach perforation. This also we have studied. Now teeth, if you see this we have studied. Teeth is chalky, white in color. In HNO3, everything becomes yellow in color. Everything becomes yellow in color. HCl is least corrosive, so it does not affect teeth and skin. It affects only mucous membrane. Skin is blackish in color. Mucous membrane also blackish in color. HCl no effect on teeth and skin, but the mucous membrane becomes blackish in color. Boric acid causes erythema, generalized erythema. So it resembles like a boiled, so skin resembles like a boiled lobster. Skin resembles like a boiled lobster. B for boric, B for boiled lobster. Oxalic acid is found in plants. The oxalic acid, what happens is the oxalic acid in the stomach combines with the hydrochloric acid, which leads to formation of acid hematin. And this gets, so this causes coffee colored vomitus, coffee colored vomiting. It causes coffee colored vomiting. And then this oxalic acid combines with the body calcium to cause, which leads to hypocalcemia. Hypocalcemia. So the and hypocalcemia and calcium oxalate crystals in urine, just like ethylene glycol. So these you can see are the symptoms of hypocalcemia. Carbolic acid is also called phenol. It is used as disinfectant, or you can say antiseptic. So it has special features. It initially it causes pain like any other corrosive, but later on it causes anesthesia. Okay, that is characteristic. And then second characteristic point is it causes bleaching, so the tissues become whitish. And third point is it causes hardening. That's the reason it can gastric lavage can be done. CNS, it's a CNS depressant. Then in carbolic acid inside the body is converted to hydroquinone and pyroketacol. These compounds deposit in the body tissues to cause blackish discoloration called ochronosis. They compound in the urine to cause greenish urine called carboluria. Okay, and then they are detected by ferric chloride test. With ferric chloride, the urine becomes bluish in color. With ferric chloride, the urine becomes bluish in color. Treatment: don't give NAG. Don't give neutralizing acid, don't give activated charcoal, don't give gastric lavage, don't give MSs, except phenol, where the gastric lavage can be done. Okay, then double D is to be given with in small amount. Double D is to be given in small amount. Otherwise, it can lead to vomiting. Like double D, D for dilution, D for demulsion. Dilution by water, little bit water you can ask him to drink. Demulsion, example, little bit butter. Little bit butter you can ask him to drink, only little bit. And keep NPO and other treatments are main. Okay. Now, heavy metals, all the heavy metals basically cause GI irritation. So, features like that of gastroenteritis occur. All of them cause metallic test, nausea, vomiting, diarrhea, abdominal pain, just like gastroenteritis. I will just tell you some classical features also. In acute arsenic poisoning, apart from these features, general features, the main differentiating feature is here the diarrhea is initially bloody, which later on becomes rice watery, like cholera. That's the differentiating feature. Thallium poisoning, the classical feature is, characteristic feature is alopecia. Mercury poisoning, the characteristic feature is gingivitis. I'm talking about the acute poisoning. Chronic we will discuss separately. Acute lead poisoning, like you can see, most of the heavy metals cause diarrhea, but lead causes constipation. Acute copper poisoning, it causes hemolysis. It causes hemolysis and large amount of bluish vomit. Okay. So these are characteristic of acute poisoning of different heavy metals. Now, arsenic and thallium, the best sample to detect is urine. For lead, it is blood. Organs where arsenic is found less, it's blood and brain. Blood and brain. Highest concentration is in liver, followed by kidney. And it is found for prolonged period in keratinized tissues like bone, hair, nail, etc. and skin. Okay. So because arsenic is irritant, so it will start causing irritation from throat itself. So there is throat pain, followed by vomiting, followed by purging, that is diarrhea. Whereas in cholera is not an irritant. So here the first thing is purging. Okay, purging. Now purging leads to vomiting and vomiting leads to throat pain. So opposite sequence. Okay, vomited matter is and stools. These are all having garlicky odor here. So main thing you can remember, not even garlicky odor. For stools, I have told you it's initially bloody, later on becomes rice watery. In cholera, they are always rice watery. They are not bloody. Vomited material in arsenic has garlicky odor. Garlicky odor. Not in this. Tenesmus and anal irritation occurs in acute arsenic, not in cholera. Because arsenic is irritant. Chronic peripheral neuropathy occurs with arsenic, thallium, mercury, and lead. The difference is in the first three, there is mainly sensory neuropathy and less of motor. In lead poisoning, there is more of motor neuropathy and less of sensory. Then there is skin, there you can see hyperkeratosis, keratosis of palm and soles. Then rain drop pigmentation. Then Eldritch Mees lines are seen in arsenic and thallium. Good morning. Here, remember, it causes alopecia. So how do you remember? Hair on mat. mercury, arsenic, and thallium. Black foot disease is seen in arsenic. Okay, then bone marrow depression, malignancy, and stomach. There is a red, velvety appearance. Okay. Thallium, please remember, it has 90% features similar to arsenic. But you choose thallium only if alopecia is present, because alopecia can occur in arsenic, but it is much more common in thallium. So alopecia, if it's given, then always choose thallium. Mercury, there are these tremors occur. These tremors are partially coarse. They start in hands and then they spread to rest of the body. These tremors are also called Danbury tremors or Hatter's shakes or glass blowers shakes or concussio mercurialis. There is gingivitis, blue line on gums. Blue line on gums is basically seen in lead poisoning, but it can also be seen in MCI, that is mercury, copper, and iron. Okay. Erythema is a various neuropsychiatric disturbances which occur in mercury poisoning. Mercurial lentis is deposition of brownish mercury vapors on anterior lens capsule in both the eyes. Kidneys, MGN occurs, colitis occurs, which resembles diphtheric colitis. Okay. Then acrodanioping disease is the chronic mercury poisoning, chronic mercury poisoning in children. Minimata disease. Minimata disease occurs due to methyl mercury. There are mainly neurological features. Chronic lead poisoning. A for anemia with basophilic stippling. Basophilic stippling occurs in RBCs. These blue dots occur. These blue dots are aggregates of ribosomes. These are aggregates of ribosomes. Okay. Then these are the enzymes inhibited by lead poisoning. Especially you remember A-lead. Lead inhibits A-lead. Easy to remember. Then B for Burton's line that we discussed, bluish line on gums, and B for bone line. The lead gets deposited in the metaphysis of long bones. Then C for colic and constipation. D for drops, foot drop and wrist drop occurs, also called lead palsy. E for encephalopathy, and F for facial pallor. Facial pallor is the earliest feature. And more sensitive, who is more sensitive in lead poisoning? Children, because their brain is still developing. When a blue vitriol is copper sulfate, blue means copper, oil of vitriol is sulfuric acid. So main organ affected is brain, liver, and eyes. And you can see that there occurs KF ring occurs in cornea. So KF ring in cornea due to copper. And then if chronic copper poisoning on inhaled basis causes Vineyard sprayer lung disease. It's a kind of interstitial lung disease. Barium non-toxic is used in radiology. Toxic is used as rodenticide. It causes hypokalemia with characteristically symptom of muscle weakness and paralysis. Barium. Okay. Iron poisoning, acute iron poisoning occurs accidental because children get attracted towards these tablets. Chronic occurs due to chronic blood transfusion in thalassemia, etc. Clinical feature acute poisoning. It basically causes various GI features. Okay, like nausea, vomiting, etc., etc. Chronic, it basically causes hemochromatosis. Okay. Multiple rat. What is present in rat? We have to kill rat. You are asking what is present in rat. We can kill rat by anything. We can kill rat by strychnine. We can kill rat by warfarin. We can kill rat by aluminium phosphide, zinc phosphide, anything. It's our wish. We can kill him by barium. Okay. चूहा मारने का क्या है? Like a human being can be killed by 100 ways. A rat can also be killed by 100 ways. Now, iron tablets are opaque. So this X-ray is characteristic of iron poisoning. Okay. Cadmium. Please remember, basically cadmium affects bone and kidneys. These two organs are mainly effective in cadmium. So it basically is a very painful. It causes osteomalacia, osteoporosis. So it's called ouch disease or itai disease. Whenever in your exam you see flu-like or malaria-like symptoms, okay, then it is metal fume fever. Which metals? Jam. Z for zinc, A for aluminium, M for magnesium. Basically various fever and flu-like symptoms. Flu-like symptoms occur. Phosphorus, white phosphorus toxic, red is not toxic. Appearance, it is waxy cylinder and it is powder form. Spontaneous combustions occur in white phosphorus, so it is kept under water and it also glows in dark. So because it's poisonous, so it's a composition of fertilizer, insecticides, rodenticide, and because it undergoes spontaneous combustion, so it's a component of firework and incendiary bombs. Whereas on the side of matchbox, because it is used on daily basis, so we can't use a poisonous thing. So that's the reason red phosphorus is the component of side of the matchbox. Okay, written. Satyam Singh. So acute poisoning, contact poisoning, it causes yellow burns like nitric acid poisoning. Ingestion, odor, there is a garlicky odor, very important. Vomit and feces, they glow in dark. They glow in dark and fumes come from these. Fumes come. So that's the reason this is also called smoky stool syndrome. It is hepatotoxic. And then chronic poisoning of phosphorus causes osteomyelitis. As you can see, chronic poisoning is called phossy jaw. Phossy jaw. Okay. Snakes. Poisoning by snake bite is called. Sir, ये white phosphorus से हो रहा है ना? हाँ अनुष्का, these are all by white phosphorus. Red is non-toxic, but that does not mean you start eating red phosphorus. Okay. Ophitoxemia is poisoning by snake bite. Spider, scorpion, and Spanish fly, they can cause uh, these three things. They can cause priapism, painful long erection. Spanish fly is also called cantharides. Spanish fly is also called cantharides. Okay. Neurotoxic snakes are cobra and krait. Vasculotoxic snakes are vipers, that is Russell's viper and saw scaled viper. And pit viper. Myotoxic snakes is sea snake. Neurotoxic snakes causes paralysis, ptosis, and ultimately because of that respiratory failure. Vasculotoxic causes consumption, coagulopathy, which leads to bleeding. And bleeding also leads to hypovolemia and acute renal failure. These cobra, crate, saw scales, and Russell's viper. These are the four common snakes found in India. Sea snake causes myoglobinuria. Myoglobinuria causes acute renal failure. Okay. Russell's viper, though it is vasculotoxic, but it also has some neurotoxic features. Remember this. Okay. Please remember most of the poisonous snakes are have very severe local symptoms, but there are two exceptions. That is crate and sea snake. These are poisonous, but still they don't have any local symptoms. Most painful is vipers. ARF means acute renal failure. Neurotoxic symptoms with significant local symptoms. That will be cobra or crate. Tell me. It will be cobra or crate. Batao, cobra. Minimal local symptoms. Crate. Vascular symptom only. Saw-scaled viper. Both Russell's. Management at field has minimal role. Minimal role. Main treatment of snake bite is anti-snake venom. That's the main treatment. Okay. But always to be done, reassure, immobilize below heart level. Rib is always to be done. May or may not be pressure immobilization. This is a kind of light pressure. This is a kind of light pressure, as you can see. Light pressure in vasculotoxic snake. So don't even give light pressure. Don't give any pressure. But in case of neurotoxic snake, you can give light pressure. Vasculotoxic, don't give any pressure, just immobilize. In neurotoxic snake, you can give light pressure. Tight pressure, incisions at bitten area, topical chemical sucking, all these things are never to be done. Okay. And cleaning with soap and water is also plus minus because the venom, because when you do the cleaning with soap and water, there is a risk of venom spreading. So not much use. Understood? So anti-snake venom is the main treatment. It is polyvalent. It contains antibodies against all the common poisonous snakes found in India. So main treatment is anti-snake venom. But apart from that, neostigmine plus atropine can be given in case of neurotoxic snake. And in neurotoxic snake also, it is much more useful in cobra as compared to crate. Ventilatory support in neurotoxic snakes, dialysis in vasculotoxic as well as myotoxic snakes, blood transfusion in vasculotoxic snakes. Okay. How whether snake poison treatment is required or not is depends only on signs of envenomation, not on bite mark or snake identification. If there are any systemic sign, then anti-snake venom should be given. If no systemic sign, only local sign. If no systemic sign, only local sign, then you see that the signs, local signs are severe, then also you give anti-snake venom. If there is local signs are, if only mild local signs are given and no systemic signs, then don't give anti-snake venom, but observe the person for 24 hours. But observe the person for 24 hours. Okay. Now, most useful bedside test is 20-minute clotting test. 20-minute WBC test. Okay. So remember the mnemonic BLP. So B for belly scales are large in 10 minutes, need 20 minutes. You for 20 minutes, you keep the vial. So if the blood clots, it's normal. If it doesn't clot, this is vasculotoxic. It doesn't clot, it's vasculotoxic. Okay. Whole blood clotting, whole blood. WBC means, here WBC doesn't mean white blood cell. WBC means whole blood clotting test. Whole blood clotting test. So BLP, belly scales are large in poisonous snake and they are small in non-poisonous snake. Sir, if it clots, it can be neurotoxic. हो सकता है, it can be neurotoxic also. Basically, what I mean to say is, if it doesn't clot, then it is vasculotoxic. Otherwise, it can be anything. Head scales, opposite. It will be small here and large here. So there are certain exceptions. That is, the snake is poisonous, but still the head scales are large. Large head scales. The snakes are poisonous, but the head scales are large. This occurs in 3 poisons: cobra, krait, and pit viper. Cobra, krait, and pit viper. Here the snakes are poisonous, but the head scales are large. It has 2 fangs, hollow, narrow teeth, plus, of course, multiple small teeth. Non-poisonous, only small teeth. Okay, so these are the bite marks of poisonous, and these multiple bite marks you will see in non-poisonous. Okay. So snake with, whenever you see any hood, that means it is cobra. Cobra has hood. Now, king do not wear spectacles. So with spectacle marks, this is the spectacle mark. This is common cobra. And you can remember like this: king don't wear spectacles. So without spectacle mark is king cobra. Okay. So both will have hood, common cobra and king cobra. But the common cobra will wear spectacles. Common man wears spectacles. King doesn't wear spectacles. The white with white bands, whenever you see white band, this is krait. This white bands you see, krait. This you can leave. This you can leave. Okay, just these 2 are more important: cobra and krait. Sir, remove spectacles. Chalo, I am an exception. I am king, but I still wear spectacles. Okay. Common symptom of spider, scorpion, Spanish fly, I told you, priapism. Scorpion bite. Scorpion bite has a stinger on tail. Here, you can see. And basically, it causes catecholamine release. So that's the reason. The characteristic, there will be very high heart rate, high BP. That's the reason we give prazosin. Toxalbumin, please remember, Ricinus RCA is toxalbumin. Ricinus communis, croton, and Abrus precatorius. Toxalbumins are plant poison, but they resemble bacterial toxin. In action. Artificial bruise is produced by SCP, Semicarpus, Anacardium, Calotropis, and Plumbago. Which one inhibits protein synthesis? R and A, Ricinus communis and Abrus precatorius. R and A, Ricinus communis and Abrus precatorius. So I will write full. Ricin and Abrin, which is used to make sueys and resembles viper snake bites. Abrin. To put marking on clothes, Semicarpus anacardium. Capsicum venom causes Hunan hand, and Hyderabadi goli. Hyderabadi goli. Okay. Active principle resin, resin, croton, crotin, abrin, semicarpus, semicarpol एंड बिलावानॉल। बस खत्म ही हो गया यार, क्यों चिंता कर रहे हो, बस फिनिश है। उल्टी गिनता शुरू करो, 1 लाख से शुरू करो, उल्टी गिनती गिनना, अभी खत्म हो जाता है क्लास। अर्गोट, इट विल बी डिस्कवर्ड मेनली इन पीएसएम, caused by fungi, claviceps. Hyderabadi goli is not shooting. Hyderabadi goli is on a stick. You apply the capsicum and it is inserted inside the anus. Okay, it's a kind of torture. Claviceps purpura. It grows on which plant? This is Claviceps. It grows on which plant? Rye. Okay, so it leads to the form. So this fungus grows and leads to formation of a mass called ergot. The basic feature is, number one, it causes convulsions and it causes dry gangrene. So because it causes dry gangrene, so there is very burning sensation. So it is also called Saint Anthony's fire. Saint Anthony's fire. Okay, strychnine, Strychnos nux vomica. Active principle, strychnine, brucine, loganine. Main body part affected is spinal cord, anterior horn cells. Main feature is seizures. Okay, but main differential diagnosis is tetanus, because in both of them, both strychnine and tetanus, those seizures occur but consciousness preserved. That's the reason. Okay, so all S, 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 S. Onset S, again strychnine S for sudden, tetanus gradual. Muscles are again S for, so all S simultaneously, and here it is gradual. And here contraction, and then muscles become completely soft. And in tetanus, even after the contraction, the muscles remain rigid. Again S, all S. So ST here, ST, strychnine ST, so it is post synaptic. It is pre-synaptic. Neurotransmitters inhibited, glycine. Here it is glycine and GABA. Okay. Posture, most common posture is hyperextension, that is called opisthotonus. Hyperflexion of spine is emprosthotonus. Lateral bending of spine is pleurosthotonus. Peripheral poisons are not very important. You can remember here यहाँ पे लिखा है, the peripheral poison, they are not very important. Active curare and conium. Curare, the active principle is curarine, and here the active principle is conine. Both of them, they basically inhibit neuromuscular junction, which leads to paralysis. Consciousness is preserved. Yes, glycine and GABA in strychnine. Glycine and GABA in tetanus. Agar if there is some error in some notes, then correct it. Strychnine is glycine, tetanus is glycine and GABA. Okay, tetanus is glycine, but tetanus is presynaptic. No, so presynaptic means it will block anything which is getting released. Presynaptic means it is getting, so this is neuron. If something is blocked here, tetanus blocks presynaptic. So suppose synapses is here. It blocked here, so everything which is getting released is blocked. Cardiotoxic poisons are Dhonaq. DHONAQ. Okay. Most of the cardiac poisons, they decrease blood pressure. Please remember, and most of them, they cause arrhythmias. Okay. QT prolongation, this is not important. Then hydrogen cyanide, please remember hydrogen cyanide, the main differential diagnosis is methemoglobin and carbon monoxide poisoning. Hydrogen cyanide occurs due to industrial fires, most commonly, followed by cyanide salts, and rarely due to bitter elements. Bitter elements. Methemoglobin occurs due to drugs, especially which drugs? Drugs which contain nitrites, dapsone, etc. And carbon monoxide, one common cause is uh, car exhaust, in garage, and then home fires like Angithi. Okay, home fire like Angithi and all. Mechanism of action, hydrogen cyanide, it inhibits cytochrome C oxidase. So oxygen cannot be utilized. Methemoglobinemia, it damages the hemoglobin. Inside the hemoglobin, what happens is Fe2 plus is converted to Fe3 plus. So oxygen carrying capacity is decreased. CO makes COHB. COHB also the oxygen carrying capacity is decreased. So clinical presentation is hydrogen. Basically, all the hypoxia features occurs in all of them. Hypoxia features occurs. So main thing is you can see here the color is cherry red, and here it is chocolate brown. So because it's chocolate brown, so cyanosis will occur only if the color of the blood is dark in color. If it is light, cyanosis will not occur. So that's the reason cyanosis does not occur in cyanide and carbon monoxide. It occurs in methemoglobinemia. Oxygen is mainly helpful in carbon monoxide poisoning. Okay. Poisons which inhibit cytochrome C oxidase, we know it's hydrogen cyanide. Then it is also aluminium phosphide and zinc phosphide. Then hydrogen sulfide, all the ides basically. Here's instead of hydrogen cyanide, so all the ides, and then also carbon monoxide. Though carbon monoxide main mechanism is making COHB, but it also inhibits cytochrome C oxidase. So all the ides. Cyanide, phosphide, sulfide, carbon monoxide, ides, all the ides. Oleander, two kinds, white and yellow. The white oleander active principle is oleandrin and nerin. Here it is cerberin, thevetin, and thivetoxin. And mechanism of action is all similar to digitalis. Last slide. Basically, the poison which inhibits cytochrome C oxide, hydrogen cyanide, aluminium phosphide, zinc phosphide, hydrogen sulfide, carbon monoxide. So all ides. Aconite is also called meetha zahar. Most characteristic early feature is tingling around lips, followed by numbness. Tingling around lips followed by numbness. Why cyanosis in methemoglobin? See, what do you mean by cyanosis? Cyanosis means the skin appears dark in color, bluish in color. No, because methemoglobin, the color is chocolate brown. Because the blood becomes dark in color, so the person appears bluish because the blood becomes dark in color. Okay, and why the blood becomes dark in color? Because methemoglobin is dark in color. We see whenever something is dark, okay, this is not a time to go into concept, but okay. Veins, why do veins appear blue? The color of the blood is not blue, but the color of the blood is dark. That's the reason veins appear blue. Same concept. Chocolate brown, dark color, veins appear blue. Everything appears blue. Then basically aconite, initially it causes stimulation followed by depression. That's the thing. So that's the reason initially tingling, then numbness. And there is alternate contraction and dilation. So this is called hippus. Hippus. Okay, miscellaneous poisons, these are all rodenticides. Please remember, vitamin K1 is used as an antidote to warfarin. Warfarin rodenticide. Aluminum phosphide or zinc phosphide has same mechanism. They are converted to phosphine gas in stomach. Phosphine gas inhibits cytochrome C oxidase, and it also causes oxidative stress. So basically all organ systems are affected, but especially what system is affected is cardiovascular. There is profound hypotension and arrhythmias. Okay. Chloral hydrate. It is also called Mickey Finn or knockout drop. The person becomes unconscious and he is robbed of his belongings. Treatment of rat poison. I told you in antidotes. Rat poison, it will depend upon which antidote, which rat poison we are talking about. I told in antidote, for example, for aluminum and zinc phosphide, I told you it's magnesium sulfate. For anticoagulants, it's vitamin K1. Okay, so it will depend upon the antidote. No, it will depend upon which rat poison we are talking about. Cannabis, bus karo. Bis means bus karo. So, for example, in cannabis, the person loses all lethargy and lack of interest. So that is called a motivational syndrome. So on one hand, there is a motivational syndrome, and second hand, you can see the person becomes so agitated. There's an impulse to murder. This is called run amok. So MO in both. MO here, MO here, MO in both. Okay. The thyroid sativa active principle is beta oxalyl amino allelane. Main clinical feature is symmetrical spastic paralysis of lower limbs. Symmetrical spastic paralysis of lower limbs. Rave drug, ecstasy or Molly. This is the local names for MDMA. Methamphetamine. Chloral hydrate से क्या होता है? If chloral hydrate is mixed into the drinks and given to the person suddenly becomes unconscious, and then rape, robbery, all these things can be done. Psychedelics or hallucinogens. Most common type of hallucination is visual. Example of psychedelics: one mescaline, LSD, psilocybin, and phencyclidine. So please remember the first three. They affect serotonin receptors. Okay. And what about phencyclidine? It is NMDA antagonist, like ketamine. So phencyclidine is also called angel dust. And please remember, because it affects NMD, it is NMD antagonist. All the NMD antagonist causes dissociation. So phen causes den. D for dissociation. E for erratic posture and catatonia. N for nystagmus. LSD, you simply remember that there is for first few hours, there is an acute trip where all hallucinations, etc. occur. Then for few months, there is a long lasting effect. There is a bad mood, anxiety. Then even after a year or so, there is a flashback. That is the uh, uh, repeat repeat experience of acute trip. Are you getting me? Within when the person takes LSD, within few hours there is all hallucination, etc. After till few months, the person will have different cognitive effects like bad mood, anxiety, etc. And very characteristic feature is flashback. After even after 1 year, 2 year, 3 years, even if he has not taken LSD, the same acute trip, he can again experience the same acute trip. Okay, without intake. Sewer gas components are carbon dioxide, hydrogen sulfide, ammonia, methane, ether, ether, and sulfur dioxide. James. Okay. The Chinese restaurant syndrome is caused by esters. Sorry, esters. It's not ether, it's esters. Monosodium glutamate. अच्छा, bad trip. Let me explain bad trip also. पहले ये लिख लो. Monosodium glutamate. Then they can be very transient symptoms. So please remember, Chinese food is absolutely safe. It is this Chinese restaurant syndrome is a very mild illness, and that too it occurs only if monosodium glutamate is taken in very high amount, very high amount. Okay, otherwise it's completely safe. Don't worry. So here, please remember, when we talk about acute trip can actually be good trip that this person can enjoy, or it can be bad trip. Either of them. Both the things can happen. Suppose you are taking LSD, so you will either within few hours you start having very good hallucinations, that is good trip, or you can have bad experience also, that is bad trip. When flashback occurs, then either of that can occur. Either good trip can occur or bad trip can occur. Okay. Amentia phalloides is also called magic mushroom. Okay. So the toxins are amantoxin, phytotoxin, all these are active principles. Mechanism of action, it basically causes liver damage. So just remember, it basically causes liver and kidney damage. It affects liver and kidney. Okay, rave drugs I have already told. I have covered all important previous year topics. Okay, so God bless you all. Please give your feedback on my mobile number. I will wait for it. I hope you enjoyed. Okay. Thank you so much.